Welcome officially to the physical therapy mini career chat. We've got Whitney Ensor today with us, and she is a physical therapist with the Baptist Hospital System. So she's going to talk about physical therapy, just the career fields, some information for getting into the career from center. And then when she's done, you'll have an opportunity to ask some questions and get any more information that you'd like. So whenever you're ready, Whitney.
Yeah. So I'm so curious, Grace, where are you currently working? You said you're working where your mom works.
Oh, yeah, she works at a cookie shop. I'm from Ohio, and so she works at a cookie shop right now, and I'm just helping her out because the Christmas season is super busy. So I just come in a couple of days to help her.
Well, bless your heart, that is probably not an easy thing to do. So props. And so you are possibly interested in physical therapy. Feel free to break in and ask me any questions that you want to ask. I can talk for hours because I absolutely love what I do. So you just let me know when you have any questions. But as far as what I do, I am a physical therapist. I've practiced for 26 years now. The really interesting thing about being a physical therapist, well, I think there's many, but one of the really interesting things, it's very dynamic and changing. So when I graduated from physical therapy school, it was a bachelor's degree. And since then, that was in 1994, it has transitioned to a master's and then a doctorate program. So I went through several levels of education, not because I had to. My career did not. Physical therapy didn't say, if you have this degree, you have to go on to the next one. I could have continued practicing with a bachelor's, but you might feel this. I love school. I could go to school my whole life. I love learning. So it was kind of like, well, good, there's an excuse to go back to school. But I went to Center College. I was the class of 1993. I then went to the University of Louisville for physical therapy school. And again, that was a bachelor's degree back then, and graduated in 1994. I then started a master's program and was placed on medical leave due to pregnancy. And in that time, the field transitioned to a doctorate degree. So I then went back for the doctoral degree, graduated in 2012, and might still go back to school. I don't know. But as far as what I do, I'm currently a physical therapist in two places. I practice in a large hospital system. I'm here in Louisville, Kentucky. And I am a pelvic health, women's health specialist. So I deal with all things related to the pelvis, prenatal, postnatal, anything related to aging, incontinence, pelvic pain. And I also am a sports medicine physical therapist. I'm a marathoner. So I have two like really interesting caseloads that are very different in some ways, but I also work with female athletes that have pelvic issues. So it's such a variety, which is what I find really interesting about being a physical therapist. No day is the same. If you're a person that likes something being different every day, it's amazing. I guess I like variety too much because I have two practice settings. So 3 days a week, I'm at the hospital setting, and then the other two, I'm in a cash pay private pay. So we don't take insurance, but patients cash pay to see us for primarily athletic performance related. I'm in a gym. So I have like two very different clinical jobs. And then I guess I like to be busy, but I also love the academic setting. I am a part-time adjunct faculty where I got my doctoral degree at AT Still University out of Mesa, Arizona. I am a primarily online distance professor because I love online platforms and virtual and all things technology. So I teach in that program also. So do you have any questions so far? I'm rambling.
No, keep going.
Okay. So as far as how I got from center to being a physical therapist, a big part of it was just I love science. And in high school, that was okay to like science, but there weren't a lot of people. I'm pretty nerdy. When I went to center, I was surrounded by people who loved science like I did and who would study for hours. And I had some amazing professors that are not there anymore, but I had an amazing biology experience. And it just made me realize, interestingly enough, I was a music major at first. So I continued with music and biology, but just absolutely loved the whole learning process and taking it to a different level and problem solving. So physical therapy is very problem solving. Somebody comes to me, they have a problem. I have to look at the current situation and figure out what's causing the problem. Then I have to figure out, what are we going to do to fix it? We set goals. I have to be very effective at communicating that, because sometimes that patient is thrilled and other times they are angry. They don't want to be there and they don't like me telling them what to do. But we communicate, and I enjoy telling people what to do. So it's a lot about communication, problem solving, and thinking very intensely and deeply, which are all things that I got to do at Center. So as far as after undergrad, then going through that schooling, I think the other thing that was great about being a Center student, and I'm sure you can sympathize with this, is I was no stranger to studying. So in physical therapy school, there were a lot of people blown away by the intensity and the level of study. And for me, it didn't seem a whole lot different than when I was at Center. I don't know about you, but what is your undergrad major?
So I think as of now, I'm planning on majoring in Spanish, but I'm taking all the science courses that are pre-physical therapy.
So you understand studying and intense studying. And I mean, Center is not an easy school, and that's a compliment to the school. I think that's great. The other thing that helps, quite honestly, is, and so in addition to the current jobs that I work, up until 2015, I was full-time faculty at Bellarmine University in Louisville, which has a physical therapy school. So as faculty, I was part of who interviews the students coming in, and I don't know how set you are on physical therapy. If you haven't looked ahead to that, it won't hurt my feelings, but most of the schools have a pretty intense interview process, and I got to sit down on that. And one of the big things, you know, people are very concerned with their GPA and their test scores and their extracurricular experiences, but a big part of what we're looking at is, what kind of life have you experienced? Have you experienced life different than just one place? Have you been out of the country? Have you worked with different people groups? And those are all things that when I was there, and I think it still is, that Center really encourages. You know, you are forced out of your comfort level in a lot of ways. So Center, for the interview process, gave me some material. And back then, I mean, it was a bachelor's degree, so I was 22 when I interviewed. The students now are sometimes a little bit older. Some of them come to physical therapy after another career, but that doesn't mean they've had more life experience. You know, I think Center just gives you an amazing life experience and an opportunity to interact with different type people. And it helped a lot with that. So as far as what I think is great about physical therapy, there's so many different things you can do. So I specialize in pelvic health, women's health, which a lot of my physical therapy colleagues are like, good for you. I would have no interest in that. And they might work with neurological patients, people that have had a stroke or a neurological. That's something I don't do. It's a little bit slower paced and takes a lot of patience, and that's not one of my strong suits. I like a faster pace, but there's so many different things you can choose as a physical therapist to do. And I love that part of it. And you can also be quite mobile. So my husband will sometimes say, don't share this fact with people, but I don't mind. It hasn't kept me from getting any jobs. I've had 14 jobs since I got out of school because I like variety. I like to keep learning. If I'm in one place doing the same thing, not getting better, not learning, I'm a little bored. So with physical therapy, you can always change and find a new setting if you don't like what you're doing. And it also allowed me some flexibility family-wise. I did take 5 years out of the workforce when I had children in 97 and 2000. And I was able to, and you still could, step out of the field and come back in quite comfortably. So, but as far as the relation to Center, just the absolute love of learning and comfort with the level of study that's required. And then again, just the interview experience. And I think some people have white coat syndrome about professors. You know, they found it very intimidating to sit with a professor at an interview. I think a lot of schools, they hadn't had an experience of being around a professor, whereas at Center, that's a very comfortable relationship. So I think that helped quite a bit. So do you have any questions for me?
So what other settings have you worked in besides the pelvic health and what you're doing now?
I started out as an acute care therapist, meaning I was in a hospital, inpatient. So I was one of the therapists that would go see patients in their hospital rooms. I was at Norton Hospital in Louisville, which specializes in neurospine and cardiovascular. So I was seeing patients day one after their surgeries. I found it very interesting because I learned what all went on in the hospital, and I knew I wouldn't stay there forever. It was a great learning experience so that when I was in another setting, I would know what came before. So if I had a patient that came to me in an outpatient setting that said, I had a spine surgery, I would know, yes, what that's like at day 1, 2, 3, and 4. So I worked in a hospital setting, and then I loved pediatrics. So I worked in a pediatric setting where I saw, hello, I see we have someone new. Hi. I just kind of gave a summary of physical therapy and how I got there. And Grace had asked what kind of jobs I've had in 26 years. I've been a therapist, so I'm just going through those. I worked in a pediatric setting with children in the facility. So we had an outpatient facility, and then we also went in homes. Fascinating. You see so much when you go into patients' homes. I loved it. It also, unfortunately, was dangerous sometimes. There were some very underserved populations, and I loved working with them, but there were also some when we were in the homes that weren't the safest setting. That's not why I quit the job. I actually quit at that point, or took some time off to be at home with family, and then worked in a sports medicine facility, then worked in a pelvic health setting, and then worked as full-time faculty. When I was full-time faculty, I was very happy, but I didn't have a lot of time to see patients. So then transitioned to part-time faculty, part-time clinician, which is what I do currently. And again, each of those jobs had something so interesting and fun about them. It was a nice variety. Great question. Any other questions? Or Everett, I know you just came in. Did you, I guess I can go ahead and just summarize. I'm a physical therapist. I have been a therapist for 26 years. So I was a music and biology major at Center, and then attended the University of Louisville. At the time, it was a bachelor's program. The physical therapy field since that time has transitioned to a master's level, and now it's a doctoral level. So I went to University of Indianapolis for my master's, and then AT Still University, which is out of Mesa, Arizona, for my doctoral degree, where I'm currently faculty. So I'm a mix of a clinician and faculty. Happy to answer any questions. I don't know how set you are on physical therapy school, but I was also part of the interview process. So students who were applying to physical therapy school, if you have any questions about that, happy to answer them. I was telling Grace, one of the great things about Center is it gives you experiences that when we interview for physical therapy school, the grades are important, sure, but a big part of it is what kind of life experiences have you had? You know, have you experienced a lot of different types of people, been around many types of people? Have you been in different geographic areas? That's one thing we look at. Just what kind of life experiences have you had? And then another part of it is a student up for the academic rigor that's required for physical therapy school? And having been a Center student, and I know you guys can both relate to this too, you know academic rigor. It's not an easy school. I mean, you're in a high level demanding arena. So physical therapy school would not be a shock to your system because you're used to having to perform that way. Any other questions?
Did you study abroad?
I'm sorry, go ahead.
No, you're okay. Did you study abroad during your time at Center?
You know, I'm going to show my age here. They started study abroad my last year there. So, I mean, that's not an excuse, but there was one study abroad experience. It was Center in London, and it was the inaugural experience, and I was not part of that group. And then after that, I think they started a Spanish program, but I did not study abroad. One of the few regrets, I wish I had studied abroad. I was also a study nerd, and I was worried that I wouldn't get my science classes. Looking back, I should have just said, it'll all work out, and studied abroad. So no, I did not, regretfully.
So what is the biggest piece of advice you would give to students who are considering going into physical therapy?
I would say think about why you want to be there. It's not the hardest job in the world. I won't say that, but it is intensely problem solving. So if you are a person, and there are settings where this can be done. So I had a colleague say to me once, you know what I like about, and she described her job setting, it was one of the easier ones. She said, I can be thinking about my shopping list while I'm working with a patient. And it just made me cringy because to do a good job, it's not like that. Like my brain, sometimes I come home and it hurts. But so I would say be aware that if you're going to do a good job of it, it's constant problem solving because every piece of information they give you is part of a puzzle and it's your job to solve it. So I would say be ready to problem solve. And it's also physically demanding. So at age 49, and I like to consider myself halfway athletic, I run marathons. I lift weights, but there are times at the end of the day that I am physically exhausted. So if those are things that you don't enjoy, you might want to think about that. On the flip side, if you would have a hard time sitting in an office, which I would, it is a great job. I like being up, I like being mobile, I like changes of scenery. So I think that's a really important thing. And I don't know that I knew that when I went into it. I don't think I said, wow, great, I don't like sitting in an office, but physical therapy will allow me to move. It was just a later realization of, wow, that worked out well. So those are two things. That's, yeah, I think that covers it. Those are the two big pieces of advice.
Besides like shadowing or getting an internship at a physical therapy place, what other professions, like what other places would you recommend trying to work with?
So that's a great question. One of the things that is recommended but not required is if you can find a physical therapy technician position, which is hard because everybody's wanting those positions, but that is the person that is in a physical therapy office helping the therapist and therapy assistants with hot packs, maybe some exercise instruction. Having said that, really a big thing we look at with someone coming in is also having jobs in different settings. So, I mean, I had a student come in that had been a scuba dive instructor, a prospective student interviewing. And I thought that was so interesting because, first of all, it told me, in my opinion, that would be a very difficult physical setting. Like that told me that they were up for some physical discomfort. It was just also very interesting, and they were teaching it. So the fact that they were teaching something spoke volumes to me because physical therapy is a lot of teaching. So the tech job and the volunteering, yes, very important, but just, and again, having some variety, having some experiences with different type people. Someone who comes in and says that maybe they worked with people for whom English is a second language, very beneficial because you're working with different types of people. Also, just being able to find jobs, and it doesn't have to be through a job, but knowing what your strengths and weaknesses are. So sometimes taking a job helps us realize, I've been in that situation, what our weakness is, and that's okay. So a big part of, I think, having a job is learning a lot about yourself. So any job that helps you learn about yourself. And as far as the volunteer opportunities go that you mentioned, the job shadowing, a big thing is to shadow in different type facilities. So physical therapists can be in hospitals. They can be in outpatient facilities, which means people walk in to see you as the therapist. They can also be in rehab facilities where they are there specifically for their physical therapy, maybe for a couple weeks after they've been in the hospital. Right now is not a good time, with COVID, but after this is all calmed down and people are open, shadowing in those different type facilities would be a really good experience. Any other questions? I'm trying to think if there's anything I haven't covered. Again, I think a really fun part of being a therapist is just the variety it offers. So with that degree, and another area is if you're interested in being faculty. I knew that faculty would, when I was in college, that just spoke to me. I knew it would be something I was interested in. For faculty positions, having the terminal degree is required. I found physical therapy faculty fascinating, but not necessarily full-time academia. All physical therapists usually do clinical instruction. So you'll have a student there with you that you are clinically instructing through their last year of school. So if you're someone that enjoys teaching, it's an excellent, not only your patients, but you're always teaching other students, because students are required to have a year of internships one-on-one with a physical therapist.
I know this has all been super helpful information, and any additional questions that you guys have?
Right now, I'm good. You covered a lot and it was very helpful. So thank you.
Oh, you're welcome. My pleasure. I'm glad you all have an interest. And again, not trying to be a cheerleader for my job, but I absolutely do love it. If you think it's something that you're interested in, and I'm happy to answer any questions. I don't know if the students have contact info, but I'm happy to be a resource. I love my job. I love Center. I would love to help the two go together. So yeah.
And we were discussing beforehand, she is part of the Career Mentor Network. So if you guys are not on that, I would encourage you, you can find that from our website on CenterNet, same place you found, same main page where you found this schedule today. Join the Career Mentor Network, and then you can easily connect with her that way.
Sure. Yeah. And I'd be happy to answer any questions.
All right. Well, thank you so much. I know this has been so very helpful. It's been a lot of really great information, and we really appreciate you. So
Yeah.
join me in thanking Whitney today.
My pleasure. Thank you. Thank you for attending.
Well, you all have a great rest of your day.
Have a good afternoon. Stay healthy.
Thank you.
Uh-huh.